Now we're going to have an announcement of a really exciting challenge. So we heard a lot about yesterday, especially from Sachin Jain, about getting access to people who don't necessarily have access. So I want to introduce Catherine Patterson. Catherine is a program officer at the Du Beaumont Foundation. You may not know a lot about this foundation, but they've been doing some very active work recently. And here's Catherine. She's going to tell us all about a brand new challenge called Closing the Data Divide. Catherine.
Good morning. Great to see you all. So it's really time to close the data divide. And I am here today. I'm a program officer at the Du Beaumont Foundation, and I'm thrilled to join you today to announce the launch of the virtual challenge, Closing the Data Divide. We are seeking new, innovative, technologically based solutions that can address the persistent challenge in healthcare, which is unlocking data so that primary care and public health can better tackle the persistent problems of sickness and disease. So how are we going to do this? First, let me tell you a little bit about Du Beaumont. We are specifically focused on transforming the practice of public health in America. That's all that we do. That's all that we focus on. And you can see the logo for the Practical Playbook up on the screen. The Practical Playbook is an interactive web-based tool that helps primary care and public health groups find productive ways to work together, from planning and implementing a project to evaluating its outcomes and finding ways to sustain the work in the future. So what exactly does closing the data divide mean? So over the next 6 months, we're going to be working with a bunch of different teams to develop tools, strategies, and techniques that facilitate the exchange of data and foster collaborations between primary care and public health. So in a nutshell, what does primary care do? We all know this, but people like doctors, nurses, and physician's assistants, these are the folks that have up-to-the-minute data. It's very in-depth data on one person's health. It's whether or not they're sick, it's what they're sick with, what are their symptoms. But let's think about public health. Public health is that contextualized information, right? These are the folks who design smoking cessation programs. These are the folks who create health regulations, and they also perform housing inspections. These folks have the tools to make communities healthier, but their data is often very, very old. So this challenge is an effort to create connections that leverage the data and skills of each group to improve population health overall, so that we can make members of all communities healthy, no matter what their socioeconomic status is or what their insurance coverage status is. So I invite you all, if you're interested, to join the challenge. We are looking for solutions that break new ground in unlocking health data to improve the health of all Americans. We need technologies that can be easily integrated into the existing IT data infrastructure, as well as the daily workflow of both primary care physicians and public health individuals. It's not going to be easy, but that's why we created the challenge. And we're offering $60,000 in prizes. So in the coming weeks, we're going to be hosting a webinar for anybody who's interested. I'd actually like to show you how to connect with us in a variety of different ways. We're really looking forward to inviting you to think about this really complex problem and are excited to see what you come up with in order to help improve the health of all Americans. Thank you very much.